Okay, I've never had that type of introduction before, but good morning, everyone. My name is Elizabeth Shipman. I'm the Vice President of Organ Operations for the Nevada Donor Network. So I'm just going to give a brief overview of what Nevada Donor Network is and kind of our impact here in the community. So I'm not sure if everybody is aware of what an organ procurement organization is, but we are federally designated to provide organ, eye, and tissue donation services to the entire state of Nevada. This is our oversight. We are overseen by a lot of people for a lot of different variations of things. So our main regulators are CMS, and we receive federal reimbursement from CMS. The FDA oversees our tissue and ocular. HRSA has some dotted lines to OPTN. There's a lot of controversy if you look up OPTN right now in the news. They oversee UNOS, which also has a dotted line in reporting to us. Recently, in the past 5 years, CMS has, the example I usually like to give is the Hunger Games. For today, I'll use Game of Thrones, where they are forcing competition amongst OPOs. So they've divided the 55 OPOs into 3 tier systems. Tier 1A can go about their merry way, providing the services that they provide to the community. Nothing to fear. Tier 2s have to compete for their service area. So in this slide, you could see all those different color boxes throughout the United States. Those are the service areas of all the OPOs. So the Tier 2s have to compete against other Tier 2s and Tier 1s if they want to be taken over. And then Tier 3s are going to be completely decertified and will be taken over by either a Tier 1 or a Tier 2, whoever competes and bids and wins the service area. So we are entering a very interesting era for organ procurement organizations that I don't think any of us thought would ever happen. So our service area is a population of 2.8 million people. We serve Southern Nevada, and as of April 1st, we also serve 3 hospitals in Northern Nevada, including Renown Regional, sorry. So we have 15 hospitals, acute care hospitals here in Southern Nevada that are all within a 35-mile radius. So very easy for our teams to get around. If you saw in the other slides, some service areas are massive, but now that we have Northern Nevada as well as all of the rurals, we actually have become the 7th largest by land mass. So that's really huge for us. There's 45 total hospitals that we serve, and then there's only 1 renal and pancreas transplant program here in Southern Nevada. We'll get to in a little bit talking about what's happening in Northern Nevada for transplant. So that makes us a mass exporter of all the organs that we provide from our heroic donors here in Southern Nevada and Northern Nevada are exported to other states because we don't have those transplant services here. So what makes us unique as an OPO? So not only do we have the organ procurement side, we also have tissue procurement, ocular procurement. Our newest service line is birth tissue. So we are able to procure the placenta from healthy babies that are born and utilize that for making grafts, a lot of healing grafts, so a lot of optometrical use, and it's a really exciting new service line. We also have 2 clinical laboratories, so our HLA laboratory and our histology laboratory. We received a $500,000 grant from the city a couple of years ago to kickstart our histology program, and it has been going phenomenally well. And then these 2 laboratories service UMC transplant program as well as the Renown Transplant program. So nationally, donations are going up, organs transplanted are going up, but there's still a massive need. So there's over 100,000 patients that are waiting on the waiting list. But every year we are doing more and more transplants. So I think that's kind of the good news. But if we are still working, then our jobs aren't done because we kind of want to work ourselves out of a job to where there is no need for organ procurement organizations and patients aren't waiting for their life-saving organs. So this is our internal performance. As you can see, for heart and lungs, we've had consistent increase year over year in how many organs are procured in Nevada and transplanted elsewhere. Where it started to get interesting was we were seeing a dip in the livers that were being transplanted as well as the kidneys that were being transplanted. So we knew that we had to do something about this back in 2022. So we invested heavily in an organ perfusion program. So we were the second organ procurement organization in the country to receive a liver perfusion machine. And these machines have really changed kind of how transplant works. It used to be super quick. You procure the organ, it has to go into the recipient immediately because of the lifespan of this organ. But now with these machines, it simulates the liver or the kidney, the heart being inside the body. So you can actually see it starting to work. So for liver, the machine in the top right is the liver machine, and you actually see it starting to produce bile, which is crazy. The heart in the box, that's the one in the bottom left, you see the heart physically beating. For the normothermic kidney machines, you see the kidney actually producing urine. So these are huge advancements that are really exciting. The impact for us, only 55% of our donors historically became liver donors. With this new technology, 77% of all donors have become liver donors. And that's extremely remarkable because we don't have liver transplant in the community, so all of these livers do need to be exported out. Just showing how impactful the pump is. Back in 2021, 1 liver was pumped. Last year, 95 livers were pumped, so it's really, really exciting. This is the reach of where we're able to transport that machine to. So because we don't have liver here, they're going to Salt Lake, up in San Francisco, Sacramento, LA, and Phoenix. The next big innovation in the transplant and kind of donation community is the concept of a donor care unit. So there's 3 different types of donor care units. There's a freestanding, a transplant center based, and a community based. And you're probably asking, what is a donor care unit? So this is a dedicated recovery space for organ procurement. So we will transport the donor to this space, procure the organs, send them out for transplant. It also provides the family a sacred space. So currently all of this is being done in the hospital, and there's a lot of different things going on. That family rarely has real privacy unless it's in that room. This space will allow them to have a lot of privacy and more time specialized with their loved one. We purchased a beautiful building. I say that a little sarcastically, but it's beautiful with a lot of potential. It is on Sahara, it's East Sahara, about a mile away from our current office. It's a 35,000 square foot facility, 4 stories. It looked perfect when we did our couple first walkthroughs, and it already had a CT machine, which is something we need. It was being utilized as a pain clinic, so there already was 1 OR suite set up with multiple different bays. But through our plans, we're actually waiting right now on the bids from the contractors. And the first floor will be turned into a beautiful space with 2 operating rooms, 2 tissue recovery rooms, 4 ICU beds, a family room, and space for the surgical teams to hang out until they need to go to surgery. So we're super, super excited about this. And that kind of wraps up my part of just NDN. This is, I think there's flyers on all of the tables for our walk that is this weekend. So if you have nothing to do and want to come hang out, please join us. Thank you. Do you need this? Yeah.
Do I need this?
Yes,
I do. Okay. Got it.
for the video.
Okay. Thank you, Elizabeth. Thank you, Diego, for inviting us, and we appreciate being included in the conversation. My name is Joe Ferreira. I'm the president and CEO of the Nevada Donor Network. I also have a role as a board member in the Nevada Transplant Institute, but we'll get into that in a little bit. So now that you've heard about the incredible work that our team does at Nevada Donor Network, and under Elizabeth's leadership, the activities we've been involved in and a lot of the statistics you have seen have really stood out to the not just the country, but in the world. And so I think it's important to recognize that context, that we, in 2011, we were recognized as the absolute worst organization in the country. We had some very dark years. The board acted decisively. That's how I got the job, and several other leaders came to the organization. And we've now emerged as the premier organ procurement organization. So something, thank you, Andy. Appreciate it. Thank you. And so it's important that we recognize that context because, as you know, healthcare in Nevada is challenged, and it has been for a long time. Things have improved, especially through the efforts of HEALS, a lot of the hospitals, the healthcare leaders that we have here who are talented, have great ideas. But transplant is one of those things that has not really evolved. You know, we're fortunate that we have UMC that does kidneys and pancreata, but if you're a Nevadan and you need an organ, and you can't uproot your family, your support system to go to another state to get it, it's just unconscionable that we have a great donation program that's recognized as a world leader, and we cannot put those organs into Nevadans, even though they're being donated by Nevadans. So we decided we were going to do something about it because we had the financial resources, we had the influence, and we were already involved in the ecosystem. So we dared to dream, and we thought, what if we could help catalyze better transplantation in the state? And so because we have a great board of directors that a lot of the names you will recognize, leaders of hospitals, people in the community that have influence, we decided we were going to help catalyze better transplant. And so we dreamed of this concept of the Nevada Transplant Institute. And it came to life a couple of years ago. And we were fortunate, thanks to the state and thanks to the leaders in Nevada, we obtained a $15 million grant to make this a reality. And I'm proud to say that it is a reality. And you're going to hear more about that from my friend Ernesto, who represents the Renown Transplant Program. But we dreamt this dream. And now there's more transplant that can happen any day now in Reno. And we are also working on plans to expand transplantation in Southern Nevada. And so I think that's important to recognize that we have the best donation program through the Nevada Donor Network. And now we have an institute that is helping to collect and deploy the resources that are transplant related to make more transplant happen. You can't see this, especially if you're in the back of the room, but this is a timeline of everything that we went through to make this dream a reality. And you know, it was tough. We had our share of critics and naysayers and people that said we couldn't pull it off. And you're going to hear today that we did pull it off. And not only did we pull it off, but we intend, through the Nevada Transplant Institute, just like with the Nevada Donor Network, to create a premier transplant program that has reach throughout the state to give access to Nevadans. And so I'm only sharing this with you to illustrate the blood, sweat, and tears and the time it took to make this a reality. But I'm proud and very happy and honored to introduce my friend Ernesto Molmenti, who is a transplant surgeon, very accomplished. His pedigree is like no other, and he is now here in the state to complement our transplant activities. And we've known each other for a very long time. We go way back on committees and friendship, and so I hope you enjoy hearing the fruits of the labor that we are now being able to put to work in the community to have more robust transplants. So please help me welcome my friend and colleague, Ernesto Molmenti.
Thank you.
Here you go.
Joe, thank you very much. And I'm delighted today to be with all of you here to share what we've done so far. We need to transform dreams into realities. And let me show you how we've done it so far and how we're planning to keep on in the future, because we cannot limit ourselves to limited ambitions. We have to be so ambitious and we have to be scared of how ambitious we are. Otherwise, we haven't dreamt enough and we haven't pushed enough. Let me show you the results and what we think about it. Thanks to Joe Ferreira, thank you very much, Joe, for your incredible help, and to the state of Nevada. We had a $7 million grant to start the Renown Transplant Institute in Reno. And we started it. We have a state approval, we have federal approval, we have UNOS approval. Indeed, our designation is NVRR. All transplant programs are designated by 4 letters. First 2 letters are the state, NV for Nevada, RR for a Renown Regional. So we are part of the Nevada Transplant Institute. It's the first of many hospitals to follow. We plan to do our first case within the next weeks. Hopefully we'll all be able to celebrate together. And we're going to stop, and we're not going to limit ourselves to kidneys. We're going to go with livers, hearts, and eventually lungs as well. So it's a multi-stage procedure. We started with 1 organ, but we'll add all the other ones in rapid sequence. Now, why did we start this? Let's look at our train of thought. We need to do an analysis of the market. We cannot treat an illness unless we diagnose it first. Let's see what prompted us to start all this endeavor. As we can see here, according to the CDC, the incidence of chronic kidney disease is rapidly increasing, as you can see by the blue areas, in the state of Nevada, but also in the surrounding states. Look at California. Look at Arizona. People are developing renal failure at a very rapid rate. It's unclear why. The 2 main causes of kidney failure are diabetes and high blood pressure. It's unclear what's causing it, but this is a health epidemic that we need to address, and we need to counteract it. Now, we can say, yes, the incidence of end-stage kidney disease is rising, but what about the population? There are shifts, and we need to keep this in mind. Let's see how the population shifts are occurring at the present time. As you can see in this picture of the population growth by US states, Nevada has the most rapidly rising population of the entire United States. 52% over the past 18 years. And we cannot ignore this, because it's up to us to make a difference. We have to stand up and say, here we are ready to defy the challenges that are coming to us. And we're going to do it well, we're going to do it right, and we're going to do it in a way that will make all of us winners. When we have discussions, when we have any type of argument, we cannot have a winner and a loser. We need to have 2 winners so we can all keep on building and reach greater heights. Not only that, in Nevada, in addition to being the state with the greatest population growth, we are close by to the two of the main centers with the greatest population densities in the US. By far, the 2 centers with the highest population density in the western part of the United States, which are, as we can see here, the area of Los Angeles and the area of San Francisco. All those people are moving to our state, by the way. All right? Keep it in mind. Now, we have defined that there's an increasing incidence of kidney failure in Nevada and the surrounding areas. We have defined that we are in 2 areas of high population density. Let's see how we're doing overall. What's happening to all of us? Over 600 Nevadans are waiting for a kidney. Keep in mind, this is a far underestimation. These are the people who are waiting for a kidney. It does not include the people who have chronic failure, chronic kidney failure, the people who have not been evaluated for a transplant, does not include the people who are being evaluated for a transplant. So this, by far, the number is more than double that. So we have that number for people waiting for a kidney, which represents about 80% of the people on the wait list, all right? Out of a wait list of about 105,000 people, 80% are waiting for a kidney. Then the rest is for livers, hearts, lungs, small bowel, pancreas. People, when they wanted to go from Reno for a transplant, they could not have a transplant in Reno. They had to travel hours away, hundreds of kilometers, hundreds of miles away. Here I put you the main centers. You can see all of them 4 hours, 8 hours, 5 hours. Those who could not afford to go anywhere in Reno, they died. Be aware, please, that you can tell me, yes, they could go on dialysis. Let me tell you something else. The mortality on dialysis is 60% at 5 years. More than half of the people on dialysis are dead after 5 years. Worse than a cancer. And we need to do something. We cannot stand idle. We cannot see and see how these people are buried. No, we have to do something, and we did. Let's look at Las Vegas. Cannot run away so quickly. If people cannot get a transplant locally, they have to go to other areas. Phoenix, 4 hours away. Los Angeles, 4 hours away. San Diego, 5 hours away. Not only that, when they go there, they need to stay for a prolonged period of time until they recover. They cannot go alone. They have to take somebody who will take care of them. This has major social and financial implications for everybody, for the state, for the individual, for the community. Let's look at what happens with our organs. We have the best organ procurement organization in the whole country. Yes. Correct me if I'm wrong.
You are correct.
All right. We're standing strong here, guys, all right? I mean, we're not taking any prisoners. What happens to our organs? Let's look at the kidneys. 217 kidneys were recovered for transplantation. 141 other kidneys were recovered but not utilized. We have an underutilization of organs. We're throwing organs away that could be transplanted. That's unacceptable. Unacceptable. Not only that, many of the organs that we recover here are sent outside of the state. You can see there, with the red arrows, the two main population areas with the highest population densities. We're sending them there. So we have a paradoxical event that seems unreasonable, but is what's happening, that we have individuals from Nevada who are leaving the state of Nevada to get a transplant from organs that are coming from Nevada. And we have to put a stop to that. And that's why with the NTI we said, we're going to stop this and we're going to do something that will work and we're going to help the Nevadans. Because this cannot keep on. Again, let me repeat, this cannot keep on, and we're doing something about it. Now, let's look at where are they going? Where are these people leaving the state to go to? What are those centers? There's a center in Nevada. All the sites I've shown you are publicly available. All right? You can quote me, you can go and verify yourself. We have a center in Nevada that has about 300 people on the wait list. They did about 170 kidneys. Only 4 last year were from live donors. A live donor is a person who's very healthy who decides to donate an organ. Only 4 out of 170, that's a very low number. At Renown, we're going to start to do live donors, and we're going to do them with a robot. And not only that, I've requested and demanded that the donors where the live donors who will be done at Renown are done not only with a robot, but with the latest robotic technology called the DV5, the latest robotics. We're going to provide the best service. There are other centers in Arizona. By the way, all centers are ranked according to a 5-bar system, like 5 stars. 5 means it's at the top, 1 means it's at the bottom. We have to be cautious when we interpret this, because somebody may say, yes, somebody has a 5-bar result, they have excellent outcomes. I can counteract you and tell you, yes, you have better outcomes because maybe you haven't challenged yourself enough to it. Are we challenging ourselves? Are we pushing? Are we doing the best we can? Are we taking some risks? So that's something to keep in mind. But here I've listed the centers in Arizona, the centers in Southern California, and the centers in Northern California. Let's look at something, for example. Let's see how much one of the major Northern California centers, the one at the very bottom. If you look here, this tells you what % of the people on the wait list have been transplanted over the past 3 years. 10% and 12%. That means most people are not being transplanted. That means we have a major crisis here. So that's what we have to fight. We have the best OPO, we have the best organ procurement organization, we have to fight to get more organs, we have to fight to get more live donors, and we have to fight to get more people out of dialysis. We cannot just ignore this. We have to be greedy. We have to fight for more, and the more that we have, the more that we want to have. Now, let me show you our vision. And let's keep in mind, it's been said by somebody in the past that when you look at the abyss, when you look at a precipice, when you look at something, the abyss looks back at you. Let's keep that in mind, because when people are coming to our state, maybe we should think about also going to their state to retribute the favor. All right? So let me show you what we have here. Ernie, yeah.
Number one, it's Nevada.
Nevada, yeah.
Get that. But mainly, I haven't heard anything about the VA system and how you fit into the VA system, or it fits into
The VA has several designated centers where they do transplants. And we can tell the VA we're happy to do their transplants at our centers if they want to. All right, they have they provide for their immunosuppression medications and other things. So the VA has their own designated hospitals where they do transplants nationwide.
They also have a community care program that UMC will take VA patients.
But tell them we'll be happy to take over their patients as well at Renown. All right. Nevada, yeah. So let's see our vision. This is the Renown Transplant Institute and the Nevada Transplant Institute. All right? In the state, we have about 3 million people, spread in the following part: 5 million in the northern part of the state, 2.5 million in the southern part of the state, in the main cities mostly. All right, so we have a catchment area of about 3 million. If we look into the other areas, we have Northern California has a catchment area of 10 million population. If we look at Las Vegas, it has a catchment area of about 2.5 to 3 million people if we include the northern part of Arizona as well. If we look at the Southern California area, there's a 25 million population, and in Arizona, a 5 million population. So we have a great area, 30 million population that Las Vegas could encompass if we decide to aggressively pursue these areas. They're coming to us, we can go to them. I mean, that's not an issue. It's up to us to make the decision to do it. We also have the 50 million in Northern California. So we have an incredible opportunity here that we have to grab and run with it and move forwards. Overall, 45 million. All right. Now, we cannot limit ourselves to ideas. We all have to go to major things. We have to have the PR, we have to have the leverage to go for it. These are the shows we've been into already so far. We've been in the Today Show, in The View, Fox and Friends, CNN. We have to relay our message to other people. We have to tell them we're alive, we're here, we're well, and we're going to win. We're here to win, all right? I mean, no question about it. And we're going to push forwards to achieve things. Not only that, people will tell us, well, but are you academic? What have you done? Let me tell you, these are the books we've published. We have books, we have patents, we have over 300 peer-reviewed articles. So we have armed ourselves to provide an incredible service. And as somebody has said before as well, the truth is marching on and nothing will stop it. We're going to win here and we're going to provide a service that's needed and that we're going to do. Before finishing, I want to wish happy birthday to Elizabeth, who was recently named a remarkable woman, and to my very new friend, Adriana. Happy birthday. I'm delighted to be here with all of you, and I'll be delighted to take some questions from all of you. And make them challenging, please, all right? Nothing of mild questions. The more challenged, the better. What's your name?
Ed,
Ed. Ernesto. It's fine. Call me Ernesto.
with the population of Nevada strongly down here, why located up north?
Well, you know, it was an underserved area there. So we're going to start there, but we're coming here. It's a matter of time, all right? So, yes. Yeah, people were dying there. Here we have a very good center as well in Las Vegas. But I mean, we started there. We're going to bring livers. We're going to bring hearts and lungs. There are also some insurance issues that we're trying to address. And but we have to, again, we have to analyze the market. We see how to approach it. Based upon our analysis, it was beneficial to start in the north and then progress to the south.
So that was the question.
Yeah.
What was the benefit of being up north? So property was given to you, or?
Well, we have Renown is the #1 hospital in the whole of Nevada, ranked, and they were willing to do it. With Joe, we had this, Joe and Elizabeth, we have this major grant. They wanted to start a program, and we went for the challenge. Yeah.
Yeah, I guess, if you don't mind.
Yeah, absolutely.
Just a little more context. So because UMC has a program here, and there's no program in the northern region.
At all?
Yes, there was a very influential paper published by the National Academies of Science, Engineering, and Medicine that talked about access to transplant. Usually distance is an issue, obviously demographics is an issue. And so we were looking for an area that was barren, like didn't have anything related to transplant. And because Renown has such a large community hospital and 3 campuses, we figured we would start there. But we're actively talking to Southern Nevada hospitals once Renown does its first several transplants.
Which will be soon.
Yeah,
Yeah.
to expand access here in Southern Nevada because the biggest population center is down here. I hope that answers your question.
Yeah.
What's your name?
Jay.
Jay, what question do you have?
Before he was banished from the Polite Society, Steve Wynn made the observation that the way the Las Vegas works is you have to get money from there and bring it here. And one of the big places there with a lot of money and a lot of investment in organ procurement and transplantation is the Middle East. Qatar has been doing transplantation since the early 2000s. There's a huge investment in Abu Dhabi in this. Is there a way, given the limitations that we don't have a commercial organ market under federal law in the United States, between organs, tissues, and eyes to leverage what's being done in the Middle East to bring more money here, just given the fact that you have these eye banks and other tissue banks that have locations in the Middle East and other kind of way station locations like in Florida that are actively involved in this market and seeing that you have a lot of issues, you have a lot of money, you have a lot of need in the Middle East, and they're chasing that expertise. And what opportunities do you see to develop a relationship with Las Vegas, that cash-rich, knowledge-desperate region of the world that's investing to try to bring that knowledge along with sports and a lot of other things there to diversify away from energy?
Well, we want to make, again, and you can quote me on this, we want to make Las Vegas and Nevada the transplant capital of the world. I cannot give you much details, but I used to be in the past, I used to work at Johns Hopkins. I was asked to consult on a head of state, which may have been from one of the regions you mentioned. All right. In the past, all right, cannot provide anything else, but yes, that's part of the goal as well. That's in the plan, yes. And we have some contacts that we're going to work on. We're setting the seeds now to grow, and we're growing fast with an intention to win. All right, we're in a path forwards and upwards.
Yeah, and if Jay, you know anyone that
I'm always looking there too, like looking at the Middle East, like looking at the Sphinx, like you want to invest in healthcare, we know about healthcare.
Yeah.
How do we kind of put the two together? And I think that's a real opportunity, because just looking at how, my impression has been the Middle East is really, like we were just talking about that, I want to talk about, it's just like Qatar, the sovereign wealth fund of Saudi Arabia, the sovereign wealth fund of the UAE. They're everywhere, they own most of McLaren, they've got a huge play in all the other things. So they're no strangers to Las Vegas. It's just a question of figuring out who you interact with and who can control the cash spigot. With oil at $60 a barrel versus 70 to 120 like it was in the last 4 or 5 years during COVID, how much money is available for that kind of investment? Where do we stand in that window? Are we at the end of it, or is this just like a lull until energy prices come down?
That's a great point, Jay. Yeah.
as it relates to transplant, because the institute is in its not infancy anymore, now it's growing up, I think we need to finish proving the concept. But Elizabeth just reminded me, we have visited those regions and talked to officials there, given similar presentations to this, and they're very interested in seeing how it develops, because they are looking for an ideal model for their programs. And it's possible that what happens here in Nevada could chart a path to a different model for transplant in general. Because right now, if you're a hospital that does transplant, you're limited by the will and the budget of that hospital, because you don't have another organization saying, I will support your services to do more transplants at your facility. It's all up to the hospital to do marketing, to do outreach, to recruit the patients, and it limits the possibility of making the pie bigger. If you have an organization like the Nevada Transplant Institute, which is a nonprofit separate from Nevada Donor Network, doing all of that outreach and fueling the referrals for patients and providing those referrals to the hospitals, it makes their programs bigger and provides more access to the population in general versus just one hospital influencing and controlling the whole transplant ecosystem. So the Middle East is very interested in this model, and we are having discussions with them.
Your name? Yeah.
Oh, me?
Yes.
Sure. My name is Ron.
Ron, what question do you have for us?
My question is there any age group, age limit, as far as who can avail your services?
I'm liberal-minded. So no, as long as he can tolerate the surgery, we'll transplant them.
Because I have a friend right now.
How old is your friend?
A 70-year-old.
That's fine, yeah.
But they were denied up in Reno.
Why?
Because of her age.
No. Yeah, if they were denied, it could be some insurance issue, could be some health issue.
Is there any way I could talk to you later?
Yeah.
Please.
Write down my cell phone, please. 516-528-2767. Again, 516-528-2767.
Don't call me.
I don't mind. You can call me 24 hours a day. If somebody needs to reach me, give them my cell phone. No problem at all. It's in my business card as well. We have to be open, and we have always to share ideas and to challenge the unchallengeable as well. 516-528-2767, guys. You had a question. Yeah. Yeah. No, I thought you were raising your hand. No, all right.
Telling him, my father got a liver and a kidney when he was 79.
Good. Yeah. No, do you know, there are three main benefits of transplantation. One is you live longer, you have a better survival. If you qualify for a transplant, right, we cannot hurt you as well. We do heart testing, we do other testing to make sure you can tolerate the surgery. It's a big surgery. You live longer. You have a better you have a better quality of life. For example, if it's a long weekend coming up and somebody wants to go somewhere, if a person's on dialysis, they cannot go anywhere unless they have a place where they can be dialyzed. That's why some cruise ships have dialysis centers. I'm not sure if you knew this, but some do. And the third, which is really important, is transplantation is cheaper than dialysis. Keep it in mind from a public health perspective. After about 2 years, it's cheaper to be transplanted than to be on dialysis. But it's a major surgery. It entails taking medications for life. So we need to make sure that the person can tolerate this. Otherwise, we don't want them to have a problem, like cardiac event in the table, for example. No, but call me and we'll fix this. All right? Any other questions? Yes, what's your name?
Chelsea.
Chelsea.
Act for Kids Nevada. I'd love to hear you've got great vision here, winning prospects moving into the pediatric sphere.
Correct. We plan to do pediatric cases as well. At Renown, we're building a new pediatric tower, and we plan to do pediatric transplants as well. Yes. It's a smaller population, the pediatric transplant. Yes. The causes of kidney failure and liver failure are different than in adults. They're usually congenital causes of organ failure in children. But yes, we plan to address a pediatric population that needs to be helped. Because transplantation, children who have organ failure, they grow a bit more slowly than their peers, both physically and they don't develop mentally at par with their peers. So we have to do pediatric transplants to allow those children to have a normal life and to grow and enjoy their life as well. Yes.
I love hearing that. Yeah.
Absolutely.
We're having a couple patients they know about are having a hard time getting out of state for Nevada on Medicaid. It's taking way longer to get their transplants than other children who are on private insurance. So if we can keep those kids in state, it'd be really awesome.
Correct. We're not there yet, please. All right. But yes. And one of the things that we need to also address is CMS certification, Medicare and Medicaid certification, because they have just changed the rules that now it requires 1 year for a center to be certified. That needs to be changed because we're helping the underserved, the people who cannot travel, the people who are the most vulnerable due to financial, health, and social reasons. Yeah, no, but that's a great question. Well, if there are no questions, I'm delighted to meet all of you. You have my cell phone, you can always reach me. And hopefully in 1 or 2 years from now, we're going to get together again and say, this is where we were in April 24th of 2015, which is today. This is where we're now several years, 1 year or two from now. All right, great to see you all.